If you're a registered nurse or a registered midwife with the NMC UK, you would need to do NMC revalidation of your PIN after every 3 years. So 3 years from when you were registered, you will start doing what we call revalidation. The NMC sends you an email 3 months to the time when it is due, letting you know that you're actually due for a revalidation soon and you should start taking the steps that are necessary to get this revalidation done. Revalidation basically means renewal, right? So the NMC wants to know that you've been practicing actively and safely in the past 3 years, and that you are actually good enough or fit enough and safe enough to continue to practice in your registered profession. Let's talk about what you need for NMC revalidation and how to go about it. Now, the good news is that everything that you need is on the NMC website. Type in NMC revalidation template on the NMC website. You would see all of the requirements stated out. You're going to see the templates that you can download and fill in. And then you will also see examples of filled templates. These are real life examples of nurses who have done, or midwives who have done their revalidation, and they've put in those examples so that we can actually know what to do once it's time for revalidation. So the first thing that the NMC wants you to have is 450 hours of paid practice, right? So you could be working anywhere, but it should be a job that is related to your registered field. And you should have practice for up to 450 hours. So there's a template for this. You just have to fill everything in. It is very straightforward. The second thing the NMC requires of you is 35 hours of CPD. Out of these 35 hours, 20 hours should be participatory, it should be physical, it should be something that you've actually attended in person, you've done the practical, aspect of it. So all of these 35 hours should have CPD points, and it can be on any area at all, but it should be related to what you're doing as a professional. The third thing that you need to do is to gather 5 pieces of practice related feedback. This feedback will come from anyone at all. So it could be from your supervisors, your managers, from your PDN, from just anyone. It could be from a patient as well, right? But the NMC needs 5 pieces of evidences that shows feedback of the work that you have put in the last 3 years. The next thing you need is 5 written reflections that links your feedback or your CPD to the code. So you know the NMC code of practice, you're going to link those reflections to the code. So once you write those reflections, you're going to then link each and every one of them to the code or link them to your feedback as well. It is actually very easy. Look at the examples that the NMC have on their website. You'll be able to grasp the understanding very, very easily. The last thing that you need is to have a confirmation discussion with a confirmer. Now, this person could be your supervisor, your manager, it could be your colleagues, it could even be, a professional in the multidisciplinary team. It could be a doctor, it could be a physiotherapist, but that person has to be a registered professional who is actually working in healthcare. This person is going to have a confirmation assessment with you. We'll go through all of these other requirements that you've done, all the templates. You're going to need their PIN for you to be able to go ahead with your NMC revalidation. Once you have all of these requirements, the next thing you do is go to your NMC online portal, click on renewal, and you'll be able to follow each and every process. You would have questions upon questions that you just tick yes, tick, 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 after which you can then submit and make payment for your usual yearly registration fee. You won't have to submit all these templates except you are asked by the NMC to do so, right? You just need to have them as a way of assessing yourself, and also for your confirmer to also assess and know that yes, you are actually still on the register and you're good to go for the next 3 years, right? Now, the NMC can actually ask you based on their discretion, because once you submit it, the NMC goes through all of the details that you've ticked and sent. If it is satisfactory, they send you an email that says you have actually been revalidated. And then if there's any other thing that you need to add or you need to do, if you need to submit those templates, the NMC will get you to submit those templates. So it is very, very important that you do that before you go ahead to submit the renewal. All right. I hope that this helps someone while they're doing their revalidation, and I would advise that you actually start doing it early. My name is Ngozi. I'm a registered nurse. I have practiced in Nigeria and I'm currently practicing in the UK. So on this side of the internet, we talk about nursing, lifestyle, and faith. You're going to be seeing my content in the form of videos or written text. And hey, you better engage, because there is so much packed in this year 2026. I'm so excited to uncover everything that we have in store this year. Let's grow together, guys.